I have a question. Carolyn, you were, as your bio indicates, a very strong advocate for the so-called school junk food bill that passed in 2005, that obviously was designed to limit the amount of junk food and really get at the issue of obesity among kids here in Kentucky. If there is one thing, because this problem just seems, you know, to somebody like me, so big, okay, so complex, where do you start? You know, we've got some state legislators here, we've got community leaders here, we've got teachers and educators and other folks. If there was one thing, and I'll address this to the whole panel, I mean, we talk about the importance of community level support, but if there is one thing that we could just, you know, where we have the highest point of leverage to really affect change, to kind of get the momentum going, help improve the health of Kentuckians, what would it be?
During the 4 years I worked on this issue, I'm retired from public health after 22 years. And I worked in public health the first 3 years of trying to get this bill through the legislature, and then I retired from public health and couldn't let go of it because I felt so passionate about it. I'd worked as a diabetes educator for many years and knew some of the dire effects, as many of you do, of having diabetes. And when we started seeing it in our children, it's just very alarming. And I think all of us who have struggled with any sort of chronic disease or seen loved ones or family members know it's so serious, and many people wish they could rewind and go back. So prevention is critical. That's a tough question, though, Michael. And I've got to relate it, though, to the goals of the Friedell Committee, which is passionate, involved community, individuals, parents, families. And I think I found in working on that issue that it really grabbed the attention of a lot of parents in particular who were really concerned. Once you open your eyes and really see how many of our kids are really struggling and overweight, you can't go back and not see it again. But I do believe the key is just what Elmer and Dr. Friedell, Dr. Calico, all of us believe, that engaging communities to really care, to grab one issue that they are passionate about, that they see they can make an improvement on, whether it's a smoking ban, whether it's working with schools to get more physical activity and after-school programs, whether it's monitoring what's in the vending machines or what's being used as rewards in classrooms, whether they're withholding PE or physical activity. Any of those places is a start. And in a sense, we hope to create, I suppose, a social movement of engaged citizens and communities at the local level to see that we all have a role in improving things. So there are many means by which we can go about doing that. But it's, Dr. Friedell often says if the problem's in the community, the solution lies within that community. And we all know, I think a lot of us in the health field know, that we can't come in from elsewhere and say, this is what you need to do. It gains steam and momentum and passion when people in that community come together and say, this is what we see as a problem and this is what we're going to do about it.